Anesthesia. Anesthesia. Acronyms: 23-BPG, 23-bisphosphoglycerate. Arterial blood gas. AC, American College of Cardiology. AC, acetylcholine. AC, acetylcholinesterase. Actisis control ventilation. American Heart Association. Amyotrophic lateral sclerosis. Activated perial thromboplacentyme. ARDS, acute respiratory distress syndrome. American Society of Anesthesiologists. ATM, atmosphere. BBB, blood-brain barrier. BMV, bag mask ventilation. BP, blood pressure. CCS, Canadian Cardiovascular Society. CHF, congestive heart failure. CX, creatine kinase. CNS, central nervous system. Cardiac output. CPAP, continuous positive airway pressure. CSF, cerebrospinal fluid. CV, cardiovascular. CVS, cardiovascular system. CIP, central venous pressure. CVD, cardiovascular disease. S. RX, chest X-ray. DIC, disseminated intravascular coagulation. TKA, diabetic ketoacidosis. DM, diabetes mellitus. Echo, endoco et endotracheal tube bras, fraction of oxygen in inspired air. 50, fresh frozen plasma. FRC, functional residual capacity. GA, general anesthesia. G, gastroesophageal. GERD, gastroesophageal reflux disease. G, gastrointestinal. G, genitourinary. HBI, initial hemoglobin. HbF, final hemoglobin. HCT, hematocrit. He's hydroxyethyl starch. HHS, hyperosmolar hyperglycemic state. HR, heart rate. IC, intracranial pressure. IC's, inhaled corticosteroids. International normalized ratio. IAP, intraocular pressure. IP, immune thrombocytopenic purpura. If intravenous. La, local anesthetic. LAVA, long-acting beta agonist. S, lower esophageal sphincter, LMA, laryngeal mask airway. Lock level, contus. MAC, minimum alveolar concentration. MAC, mean arterial pressure. MH, malignant hyperthermia. MS, multiple sclerosis. MSK, musculoskeletal. NMI, neuromuscular junction, NPO, nil per OS. NIHAN, New York Heart Association. OX, oral corticosteroids. Augur, gastric. Or operating room. OS, obstructive sleep apnea. PA, pulmonary artery. PACOT, arterial partial pressure of carbon dioxide. PAWO, arterial partial pressure of oxygen. PC, patient-controlled. PCA, patient-controlled analgesia. PCV, pressure, controlled ventilation. P, positive end expiratory pressure. PNS, parasympathetic nervous system. PACU, post-anesthetic care unit. PONV, postoperative nausea and vomiting. PPV, positive pressure ventilation. PVD, peripheral vascular disease. RSI, rapid sequence induction. SABA, short-acting beta agonist. Succinylcholine. Hyde syndrome of inappropriate antidiuretic hormone. SNS, sympathetic nervous system. SV, stroke volume. SVR, systemic vascular resistance. TIA, transient ischemic attack. TBW, total body water. EMA, total intravenous aesthetic. TURP transurethral resection of prostate, ERDI upper respiratory tract infection, V/Q ventilation/perfusion, VT ventricular tachycardia, VT venous thromboembolism. Overview of anesthesia. Anesthesia, lack of sensation/perception. Approach to anesthesia. Preoperative. 1. Preoperative assessment. 2. Patient optimization. Preoperative/intraoperative. 3. Plan anesthetic premedication. Airway management. Monitors. Induction postoperative. 4. Postoperative care. Types of anesthesia. General, GA/TIVA. Local, local infiltration. Topical, regional, spinal epidural, peripheral nerve block. If regional, note that different types of anesthesia can be combined, for example, general plus regional. Preoperative assessment. Purpose. Identify concerns for medical and surgical management of patient. Allow for questions to help allay any fears or concerns patient and/or family may have. Arrange further investigations, consultations, and treatments for patients not yet optimized. Plan and consent for anesthetic techniques. History and physical. History. Age. Gender. Indication for surgery. Surgical/anesthetic. Checks previous anesthetics, any complications, previous intubations. Conv. 50/1466 Toronto Notes 2021. Difficult mask ventilation. Anus anal 2000.1086 1870 1880. Purpose. Define and predict difficult mask ventilation. Conclusions. Age 55. Obesity with BMI 26. History of scarring. Beard. Lack of teeth. Malambody EI/IV. Abnormal mandibular protrusion test. And male gender. Are all independent